Some new worries for those trying to prevent the spread of measles in South Carolina. Some who thought they were fully vaccinated may not be. Caitlin Ashba explains why some long vaccinated adults are being urged to roll up their sleeves again.
Expecting to welcome a new grandchild soon, Markham asked her doctor to double check and make sure she was covered.
I got the test back and it said I was negative for any immunity. It was just part of my blood work.
Markham says she received an MMR vaccine when she was born in 1959, but was curious about how effective it still was.
Then I found out that there were years that I used a different type of vaccine, and so that's what they found, that it's not effective anymore.
The CDC says non-live vaccines typically require multiple doses to achieve protection that fades over time, requiring boosters. We asked the state health department what they recommended to patients like Markham. Their response in part read, quote, "All adults born after 1957 should receive at least one dose and ideally 2 doses 28 days or more apart of live measles-containing vaccine. A small percentage, less than 5% of adults who were vaccinated against measles between 1963 and 1967 received an inactivated, killed measles vaccine that was less effective than the modern vaccine." Dr. Linda Bell with SCDPH.
Rather than people getting tested, that they can go ahead and get vaccinated again if they received a vaccine in that late 1950s, early 1960s time frame.
The state health department claims anyone born between 1957 and 1968 who either received an inactivated MMR vaccine or is unsure what type should receive a first dose now, followed by a second dose at least 28 days later.
This isn't in an epidemic proportion in South Carolina, highest in the nation. It made me wonder why there was no coverage from the government or CDC or whoever about why these people that need to go get vaccinated.